Welcome. Please let me know who's joining and where you're joining from. All right, welcome. Thanks for joining me. Thank you for joining. Please let me know where you're joining from. Let me know who's joining and let me know, as we're starting, I heard something that's very, very funny right before I came live. And it's about one of the causes of not sleeping well. What do you think is one of the leading causes of not sleeping well? Before we go into it today, thank you for joining. I see Facebook user. I don't know who this is, so I think I might need my phone. My darling sister. Thank you for joining me. I am so excited. I'm so excited. For those watching, that's one of the psych MPs in Houston, my mentors, my pair. Okay. I have big people in the house today. Thank you for joining, Madam Olori Rotsi Ajayi. If you're familiar with this page, you will know she's the one that taught us a lot about infertility and mental health. So welcome. Thank you. Please let me know where you're joining from and we'll get right into today's topic, not sleeping well. As you're watching, do me a favor. What do you think is one of the causes of not sleeping well? Insomnia. And I will talk more about it. So, while as I'm waiting for your responses, let me get into this topic. A lot of people think that IT pumping, thank you for joining all the way from Abuja, Nigeria. Fashion engineer, right. Thank you. I'm excited. I'm excited for everybody joining. If anybody knows T Mode, please help me tag T Mode on Facebook. She needs to be here. Her team needs to be here because she is one of those that brought this sleep issue to light and while we're talking about it. So, sleep, not sleeping well. I want to tell anybody just joining that we've started this series for this is the third week. The first week we talked about what is sleep about, the phases of sleep, the benefits of sleep, and then we talked about the three major issues with sleep, the three major problems. One is some people sleep too much, some people are not sleeping enough, and some people have some unusual behavior while they sleep. Last week, we talked about excessive sleepiness. This week, we're talking about not having enough sleep. Next week, we're going to talk about the unusual behaviors associated with sleep, and then we talk comprehensively about treatment. So today, talking about not sleeping enough. Some people generally call this insomnia, but uh, so many people get it wrong. Okay, we don't understand it, and that included myself until a few weeks ago when I started doing a lot of research into this, and now I know more, and I want us all to know a little bit more so we can help ourselves and people around us. Insomnia. So in psychiatry, in mental health, or for those who work specifically on sleep medicine, not sleeping well to a lot of people, as I talk about it, is not actually insomnia. It is sleep deprivation. Okay. And you will understand what I mean as I outline the things we're looking for that brings about that will bring about the diagnosis or for us to call anything insomnia. So insomnia is generally having trouble falling asleep, staying asleep, maintenance of sleep, or you're waking up too early and you're not able to go back to sleep. And one of these three things, or all those three things are happening in this individual, but wait, that is not all. Now, if you're not able to fall asleep, How long are you giving yourself to fall asleep? So in the sleep medicine world, it's generally termed that if you're not able to fall asleep for longer than 30 minutes. Now, 30 minutes is a long time. So if you are in bed and you're not able to fall asleep for more than 30 minutes, we're thinking, something is probably wrong. Now, are you finding it difficult to stay asleep for a longer period of time? You're waking up more than like 10 times in the day during the night, or when you wake up for whatever reason you're not able to go back to bed again and it's taking you longer than 30 minutes. What's going on there? We call that's like middle insomnia. The first one is like early onset insomnia. Now the third part is, when are you waking up too early? It's too early to wake up, it's too late to go back to sleep. Are you having this issue? So we're thinking about those three parts, and this person is complaining of not sleeping well. Then we go further to say, okay, if you're having trouble falling asleep, maintaining sleep, or waking up too early and being unable to go back to sleep, we're now checking, is this affecting your life? Are you having issues with daily functioning? Is it affecting your work? Is it affecting school? Is it affecting relationship? In social setting, are you having trouble? Occupational issues, are you having trouble? Do we have all those things going on? Then we talk about, okay, maybe we're getting at something here. Further, has this thing does it happen 3 times, more than 3 times in a week? And has it been happening for up to about 3 months? So three is very important here. We're looking, is this thing happening so often? Is this thing happening, almost 3 times in every week, at least 3 times a day, three days in a week, I'm not able to sleep, or it's longer than 3 months, or this has been going on for more than 3 months right now. We're looking at what's happening. But here is one very important part. It has to be happening despite the fact that you have the opportunity to sleep. So, and here, I think this example of my patient, a patient I saw just on Thursday, was telling me, complaining about not sleeping. We're treating mood disorder and she's still having issues with, not sleeping and anxiety and stuff. And as I was doing more assessment, she never mentioned that she has a father that has an end stage Alzheimer's disease that she's taking care of. And this person she's taking care of hasn't been sleeping well at night. So she's waking up often at night. She's not getting enough sleep. When it's time to go to work, she's groggy. And she gets to work, she's really anxious and irritable. So not until I started asking, do you have any stressor? Do you have something going on? Oh, well, work is always trouble. Something is always going on at work. And then I have to care for my dad. She just said that. I said, what do you have to care for your dad for? I said, oh, my dad has some medical issues. What medical issues are that? He has end stage Alzheimer's disease. Aha. So what is going on with him? Well, he has not been sleeping well at night. He's, walking around. He's what do we call it? He wanders around at night and things. So she hasn't been sleeping. So when we talk about insomnia, someone who hasn't been getting the opportunity to sleep cannot just say that they have insomnia. There's something causing it. So we look into that first. So insomnia, in addition to all the other things I mentioned, difficulties falling asleep, staying asleep, or waking up too early, is this thing despite you having the opportunity to sleep. And then, oh, volume, okay, opportunity to sleep, and then you are not still able to sleep. So we want to watch out for that. Now, another thing is, we're making sure that this your sleep issue is not related to, and it cannot be better defined with another sleep disorder. Last week I talked a lot about narcolepsy. Narcolepsy is the sleep problem that makes people sleep excessively. They fall asleep. It can happen anywhere. It's excessive. It falls on that excessive sleepiness. It's not restless leg syndrome, where people have the urge to move their legs every time, and this happens most times at night. So they have restless leg syndrome, and it bothers them. It keeps them awake all the time. Now, if that is what is going on, you have restless leg syndrome. It is not insomnia. Okay, so that is what we'll be addressing. Now, if you have sleep apnea, breathing related sleep disorder, then that is not just primarily insomnia. You have something else going on. We need to treat sleep apnea. You know, maybe it's obstructive, maybe it's central sleep apnea. That's what we address first. So it's not just primarily insomnia. Now, another thing is it not related to any substance? Okay. Have we ruled out you having any substance issue? Like, do you take alcohol? You know, is it related to the physiological effect of you taking alcohol, or you having a substance that you take regularly? All those things we have to rule them out. And another problem is, you have any medical issues. Oh, with the substance, it could be, are you taking alcohol? Are you taking nicotine, smoking, drinking, or you're taking a medication that is affecting your sleep? We want to rule that out. Another one is, do you have a medical issue? You know, do you have pain issues going on that keeps you awake? Do you have tummy issues that keep you awake? Do you have a bladder infection that make you urinate so often? Do you have cancer? Do you have something else that brings about you not sleeping? So when we assess all these things and we ask, and we either check or rule out, or check, then we're saying, okay, we have insomnia going on here. But what actually happens is, a lot of people don't give themselves the opportunity to sleep, and they don't make the environment conducive to sleep. They have been doing so many other things. Maybe phone is one, and we'll talk more about that. So many of us, once we can differentiate between, is it insomnia, or is it that I'm being sleep deprived as a result of something going on, that is the beginning of the solution to our problem. Okay, and then we know what to do about it. So I will just briefly talk about what are the causes or risk factors, what are the complications of not sleeping, and then I talk about the solution. And that solution, we're going to talk about it together. So now that we know what insomnia really is, now that we know it's different from being sleep deprived, and a lot of business owners, a lot of leaders, a lot of executives, a lot of mothers, a lot of women, so many people watching me right now, we are very prone to that. We are sleep deprived. We don't actually have insomnia. So now we know what it is. There's the acute insomnia, acute and transient. And this falls under one of the major types of insomnia, because insomnia is the most common sleep disorder that we have. One out of every four adults have insomnia. One out of every four has insomnia. So it is a very, very common issue. A lot of people, don't pay attention to it, but we'll get to why we should not neglect this shortly. So transient, acute transient. I talked about 3 months earlier. If it's not up to three months, it's just something acute. As a matter of fact, every one of us have a time in our lives that we have sleep problems. We have a time in our lives that we have insomnia. It can be for good, it can be for bad. Hopefully we're not able to sleep for good things. You get a new job, you are moving to a bigger house, or you're relocating because of transfer for job, or something good, or you have an exam coming up, or you have a new project you want to do, and you're constantly thinking about these things and you can't sleep. And there are other issues that are negative, like maybe a loss of a loved one, the loss of job, or stress, or you're fighting with your husband, your partner. The negative issues like that can cause sleepless night. And this is where I want to talk about the funny thing that I heard today. And that's from my dad. So I was telling my dad, I was like, okay, dad, I'm getting ready. I'll go live talking about, insomnia today. And he said, I hope you did not forget one of the leading causes of not sleeping well. Like, what is that? He said, unforgiveness. Like, okay, okay. Unforgiveness is one of the leading factors of not sleeping. So, this is just one of the stressors. When you talk about, why are we not sleeping? For some people, it's just as simple as not forgiving someone. But relating that to a bigger issue, it's an issue about, you have issues with your spouse, or you lose a loved one, or you lose a job, or a storm is coming, disaster. A lot of negative things can happen, and in the moment, it disrupts our sleep pattern, and we're not able to sleep. However, this is usually shorter than 6 months, than 3 months, and it resolves on its own most times. We don't need medication to fix that. When there's a lifestyle change or a major change in our lives and you're not able to sleep, then what we need to, just look forward to, this is an adjustment insomnia, and they typically resolve by themselves. They do not need anything. We don't need what's it called? We don't need to take medication, or we don't really need active treatment for that. So that is one. Now now have that's acute. Now let's talk about the chronic insomnia. It's happening more than 3 times a day. I don't have the ability to sleep, despite the fact that I have the opportunity to sleep, and I don't have any major life changes. I still can't sleep. There these things going on. I just can't shut down, or I wake up too often. I There's a problem, and it's been going on for more than 3 months now. We have chronic insomnia. If we have chronic insomnia, what do we need to do about it? How can we address it? Now, let me use this opportunity to talk about risk factors. The risk factors, the risk factors that affect or can increase your likelihood of having insomnia. And I'll talk about them broadly. Gender is one. Women have more sleep trouble than men. Age is another one. The older you get, the more trouble we have with sleep. And with this age, let me quickly say this. A lot of people, we think that our elderly people do not need enough the sleep. Elderly people, older people just need to sleep a little, or they're not able to, enough. Shorter sleep is enough for them, or with age, people are not able to sleep like they should. Well, that is true for some reasons. They have change in their internal sleep clock. Elderly people have change in their internal sleep clock. They have change in their physical activities. They're not as active as they used to be. So they're having more naps during the day, and they are now light sleepers. They're not active, they're not tired. So when it's nighttime, they get shorter sleep. Then another thing is with their health. A lot of elderly people have issues with health. They either have issues with pain, joint pain, back pain, arthritis, or diabetes, or hypertension, something. A lot of elderly people have issues with their physical illness, physical health. So it disrupts their sleep pattern. And then a lot of elderly people, they take a lot of medications. Medications can affect our sleep pattern. Medication do affect their sleep patterns, especially when they have more than one, which is more than what an adult, or younger adults will have to deal with. So those are the things with elderly people. With age, they have trouble sleeping, but it does not mean that elderly people do not need as much sleep as younger adults. Another thing with age, let's quickly talk about teenagers. Let's talk about children. Now, a child that needs the parent before they can sleep all the time, or needs a parent to be able to fall back to sleep, that we're looking also at insomnia. We don't really see any big deal with this, or we don't pay attention to it, but it is also very, very important. Okay. Now, so that's it. Gender. Women are more prone to having trouble sleeping. And let me say more about this again. With gender, because women have a lot of hormonal issues we have to deal with. Their menstrual cycle, menopause issues, hormones during pregnancy, all this up and down can affect and impact women's sleep cycle. So that's it with women. Age, elderly people, they have more trouble sleeping than younger people. Now, let's talk about gender. Lifestyle. Everybody's lifestyle impacts their health, their sleep pattern, one way or the other. Because some people, especially shift workers, or some people who are call themselves night crawlers, or some people who don't have regular sleep pattern, those who take alcohol, those who take tobacco, those who don't exercise, and I fall under that. I'm sitting down all day. I'm seeing patients one place. I only have about 1 hour break in between to do something, and you come back sitting down all day. So how are we able to get up? How are we able to do a lot of things like that? So my lifestyle based on my career can impact your sleep. So I might not be as tired as when I was working on the floor, when I was working on the unit in the hospital, and you're going from room to room to see your patients, and you're, pushing the cartwheel, serving medications, or just helping patient get out of bed. You're more active as a nurse on the floor than as an MP that is just sitting down seeing patients in psychiatry. That is one. So with lifestyle, it can make you at a higher risk of having insomnia than some other people. Now, let's talk about family or genetics. So, with family, there's some people that in their family, they are deep sleepers, right? You'll know, and a lot of us say that, oh, my dad is such a deep sleeper. When if he falls asleep, even if a trailer is going by, he won't even know what's happening. Or my mom is such a light sleeper. If a fly should go by the room, she would wake up, and then you have that. So that's the same way that some people just idiopathically, genetically have trouble with sleeping in their family, and it's a genetic thing. So that can be part of one of the causes or the risk factors for those who have idiopathic insomnia. It's not adjustment, it's not late, it's not behavioral insomnia, it is not paradoxical insomnia. It's genetic. We don't know, so they need to do something about it. Now, another one is environment. Some of us, our insomnia is because we don't have the opportunity to sleep. Okay, we don't. We're in a noisy environment. There's too much noise. There's light all the time. Some of us sleep well with light. Some of us don't do well with light on. And so when you, for example, you have a partner that wants the light on and you don't want the light on, imagine how both of them would balance that. Imagine those who live close to a railway. Imagine those who, in the environment, maybe let's take a shift worker. You come back home, you want to sleep, and then your place, your spouse had to work during the day. So your spouse is talking all day, and all the things you have to do, you're not able to sleep. Then you have that problem. Environment can increase your risk of having sleep issues. Another one is stress. Stress divides into two. There's a stress with life generally, maybe like we said, relationship problems, issues with your boss, problems with this child does not understand algebra. They're going to have algebra, they have it 2 times a week, constantly worrying about something. There's just something going on, work, school, life, relationship, money, debt, something that stresses you around you with life. And now there's another stress of stressing about sleeping. And you'll see that a lot of pictures that you will see, a lot of stuff that you will see, it has people stressing about money. It has people looking at their clock, like, oh my God, it's 2 a.m., 2 a.m., I'm not sleeping yet. It's 3 a.m., I'm still not falling asleep. It's 5 a.m., they are worrying about how much sleep will I get? Will I even be able to sleep? And they have issues with all that. So, knowing these risk factors can help us know, or can help us determine, how am I doing with sleep? Do I really have this going on? Am I prone to insomnia? Do I need to do something about it? So, those risk factors would help you. Another one that I've heard a lot of people talk about is trauma. If you had trauma before, like I have a friend, there was an incidence of robbery that kept her, that she wakes up almost about the time the robbery happened many years ago every night. She's not able to, like, she had a sleep mechanism or a sleep cycle. There was a sleep accident that happened during that time, so she wakes up at that time that it happened, that traumatic event happened a long time ago, and she's not able to sleep. The same thing is with, trauma, like rape, like abuse, like a motor vehicle accident. Something traumatic has happened somewhere and it's affecting them. Now, that can increase your risk of not sleeping or falling asleep or staying asleep, and it's something that has to be looked into. I'll wrap up with this one, which is brain disorder itself. And it's with brain disorder, I want to talk about traumatic head injury. Sports and the kind of things that some other people expose themselves to can cause issues with sleep. So if you have brain issues like, Alzheimer's or any kind of dementia, or like Parkinson's, or you actually, there's an accident where there's, impact on the head or on the brain, this thing can cause or increase the risk factor significantly for not sleeping. So there's really no specific cause of not sleeping, even though, those in the sleep medicine can tell you this is what happened, and with maybe a sleep study, they're able to say, okay, this is what is happening to your brain waves at this time. You're supposed to be at this phase, but this phase is getting to this or to that. They're able to say that, but we can't say this is what causes insomnia. But those are the risk factors of insomnia that I just gave you quickly. The risk factors, again, age is one, environment is another, gender with females, family history or genetic issue is one, lifestyle, stress, head disorder or head injury, and then health issues, trauma. All those things are the risk factors. Now, for those who are watching, help me here. What happens to someone who haven't slept well? Help me. How, if when you don't get a good night's sleep, what happens to you? What are the things that happen? I know that the comments can be a little bit delayed, but please put in the comment. I see the few people are watching right now. So, what happens when you don't sleep well? And as I'm expecting your comments, I'll say, let's put it into two. Short-term problem with sleep. When you don't sleep well, short-term issue, you wake up and you're not just, it's almost like your brain is not awake. You are at alert and you don't know what you want to do. So you are foggy memory, trouble concentrating. You can't focus. You don't even know what, sometimes you forget things that you should. I mean, how would you forget this person's name? Or how would I forget this simple thing? Oh my God, I can't even remember. Trouble with memory. You can't concentrate. Your mind is going everywhere and you're just not focused on stuff. Not sleeping well can cause that. Uh, what about your mood? Have you heard an hungry person is an angry person? Okay, if you've heard that, how about someone with an unrestful night's sleep can be very cranky. It can be very irritable. You're just moody. You don't want people disturbing you. Like irritability, feeling sad, dull, fatigue, lack of energy, all those things, they can affect you. They can, can be effects of insomnia. Yeah, you get cranky. Your thought process most times not on point. Exactly. Exactly. And this is one of the reasons that is recommended that you sleep well a night before an exam. If you have something really big coming up, like a presentation or something major coming up, you when you hear people say have a good night rest before that exam, a good night rest before that presentation, a good night rest before you meet something, it is very crucial because you know not getting enough sleep can make you cranky, affect concentration, affect focus, make you moody and sad, fatigued, and it is not healthy. It is not. Headache is another one. People sometimes just have a headache, like my head just hurts. I think I need some water. Okay, you need some water, but getting some sleep would also restore you and you feel better. Now, on the long term, when these things keep happening, or even during the day, if you can't sleep, for elderly people, I talk about elderly people a lot because I work with this population, for quite a while. They're at risk of falling. We have fall issues going on. And even with you and I, when we don't sleep well, we have issues with sleep. I mean, we have issues with my fall. I mean, this can lead to problems at work. It can lead to failure of an exam. It can lead to poor performance at work. It can lead to you missing work because you're not just ready. Imagine somebody that works with a lot of machines and issues like that. Imagine them operating a machine or something that is very dangerous without a good night rest. Everyone around them, including themselves, will be at risk. So, fall, accident, motor vehicle accident, accident on the job, all those things can happen. A slow reaction while driving, it can even lead to anxiety and depression. It is not healthy not to sleep. But in the long term, for chronic insomnia, in the long term, it affects your brain, it affects the heart, and can affect other parts of the body when we don't get enough sleep. So we have issues like, heart issues, cardiac issues, high blood pressure, coronary artery issue, irregular heart rate. We have all that going on. With breathing, you just have trouble with sleep, with breathing. Asthma is one of the risk factors. Not just that, immune system. Your body is not able to fight, to put on that fight, the fight mechanism to fight off any kind of infection. Your immune system will go down, metabolism will slow down, so it start affecting the way you eat, how hungry you get. And what happens when you can't control how much you eat or what you eat, or when your body is not able to metabolize all the things in your body, obesity starts coming in, diabetes, issues like that we have to deal with. And mental health problem, I can't say that enough. Things that we want to watch out to. But now, for those who are watching me, again, help me with this. What do you think are the simple solutions to insomnia, not being able to sleep? This is a this is what I believe a lot of people will want to know. And this is one thing I want to speak to before we round up. What are the simple things you think people can do to address insomnia? If you started with me, you would know that I talked about insomnia is not just not being able to sleep. There's many other things we consider before we say someone's got insomnia. Now, if we have insomnia, or if you have insomnia, what have you tried? What are the things? How can we solve insomnia issues? Help me here. How can we help not sleeping? Or how can we sleep better? How can we improve our sleep pattern? I'd like you to chip in on this and tell me, what are the simple ways or the things to make your sleep better? And I'll tell you what I think. I'm looking out for comments here. How can we sleep better? What can we do to sleep better? Tell me what you think. Tell me what you think. Now, as I'm waiting, there are I classified the solution into four major ways, and I call this my M double A, my M triple A, and triple A. The first one is this: We need a mindset change. We need the right mindset. And with the the right mindset comes you understanding the importance of sleep, comes you knowing what it means to get a good night's rest, you valuing mental health by resting well. Sleep is so important. Sleep is so important. You need to understand it. You need to prioritize it. And this is where I want to say this because a lot of people, I mentioned this when we talked about excessive daytime sleepiness. Some people with sleep problems do not understand that they have sleep problems. They need you as a spouse, or you as a sibling, or you as a parent, or you as their colleague, or you as their employer, or you as even their employee, or you as their client or customer to know that they have a sleep problem. When you say it or you let them know in a loving way, it can help their quality of life significantly. So the four ways, the four classes of solution to improve our sleep with this. Mindset is the first thing. Don't join the club of I only need I only need 2 hours of sleep and I'm fine. Well, if you only need 2 or 3 or just 4 hours of sleep and you are able to function without it impacting your productivity or your memory or your concentration, then you do not have insomnia. You're good. So you don't need any treatment. So if you're able to function well, but if you're not, if you're getting the opportunity, you're not sleeping well and it's impacting your other areas of your life, then something has to be done, which starts by you having the right mindset about sleep. In the world of successful people don't sleep the time everybody is sleeping. Successful people sleep more than the time every other person is sleeping. You cannot sleep more than 6 hours and be successful. The time when people idolize not sleeping. Yes, oh my God, thank you. I will come back to this comment soon. Thank you, my sister. Mindset. Sleep is essential. Sleep is a priority. Sleep is as important as food, as air, as water, as exercise. Sleep is so fundamental to our mental health. It is so fundamental to physical health. Sleep is important. I can't say that enough. And you need to understand the mindset. Now, still on mindset, I want to tell you that sleep is not just important for you. Look out for your partner. Look out for your children. Look out for your parents. Look out for your siblings. Talk about this thing. How are you doing? I'm doing okay. Have you been sleeping well? Well, sleep. You're talking about sleep. Forget it. I can't even afford it right now. Well, okay. I know you have a project right now. I hope, when is it ending? Oh, it's ending. So is our live day or our deadline. Whenever it finishes, please, you need to prioritize your sleep. And do you know that you can even have a better, you can function better and finish what you're doing more productively if you would get a good night's sleep? Watch out for your loved ones. Sleep is important. Mindset. Now, here's the first A because it's MAAA. The first A is self-assessment of what is going on. You want to assess what's going on around you. Am I sleeping well? What time do I go to bed? Like we have here, get into a routine that makes your body understand you're shutting down for the day and keep your phone away. It might be as simple as that. How long do you keep your phone beside you when you want to sleep? How long do you watch TV before you go to sleep? Do you go to bed when you want to go to sleep? Check. Is your bed does your the way your bed is placed, do you face outside? Do you face something that stimulates you? How is your room arrangement? Assess what is going on. What time do I sleep? How many hours of sleep do I really get? You want to check all that, assess what's really going on. Am I having issues with my partner, or is my partner snoring affecting me? Just look around you and check, you know, what is going on if you think you have a sleep issue. Now, one type of insomnia that will be interesting to mention here is the paradoxical insomnia, when people actually get enough sleep, but they are worried that they're not getting enough sleep. They're just worried that they're not getting enough sleep. So, but if they would keep a journal or do a sleep study, they will find that they're sleeping just fine. They're getting enough hours of sleep. So that's where I'll say in the assessment, it can be helpful to have a sleep diary. Keep a sleep diary for about a week or two. It will help a lot. About a week or two, where you're able to check what time do I go to bed, what time do I wake up, am I taking naps during the day, how sleepy do I feel during the day, how awake do I feel during the day, what time of the day do I start getting tired, what do I do, what do I typically do before I go to bed? All those things you want to check it. You want to check it. So assess what is going on with you. The second one is adjust. If you do a thorough self-assessment of your environment, of your hours of sleep, of the number of hours of sleep, or your quality of sleep, you might just need to adjust. What are the simple things we can adjust? If you're in here, tell me. Thank you, Sister Okwe. Thank you for your contribution. What are the things you can adjust? Sometimes it's a bed. You need to change your mattress. Sometimes you need to change your mattress, or you need to change your pillow. Sometimes it's just something as simple as that. Sometimes you need to change your blinds. You need to change the blinds you're using. Change them into darker, plain ones. It might help improve your sleep. Adjust your environment. Sometimes you might need to move from one room to another one. Maybe, okay, this is the well painted room. You like the color of this room, but this other room is farther away from where where my spouse or my partner works during the day. So I'm not able to hear her voice. There's less noise if I will be sleeping in that room for shift workers in this case. It might be as simple as that. Adjust, adjust, adjust. I mean, it can just be that simple. After assessment, make the right adjustment. Lifestyle is another adjustment we might need to do, and adjust your lifestyle. You're drinking, alcohol does not help. Alcohol actually messes with the sleep phases or the sleep cycle, the sleep mechanism. Alcohol affects it, so it lets you sleep for a while and then you wake up again because you are not consistently taking the alcohol. You sleep, you wake up. It messes up the sleep pattern. Adjust your lifestyle. Now, if you've assessed, now you know that it's important. The mindset is good. Now you know that you've assessed, checked around you and everything is good. You've made necessary adjustments and things are not still going right. It might be time for you to go to the next one, which is an appointment. Get an appointment with a professional. Get an appointment with the professional. But here's the caveat with that. Yes, the mattress. Thank you. Here is the trick, the caveat with adjustment. I mean, with appointments with a professional. You also need to go to a professional with the right mindset. You need to go to a professional with the right mindset. This is where I'll wrap up today. A lot of people go to professionals. In fact, I can tell you some people clients that I see in my clinic, that what they're coming for is to come and say, my primary care physician says he cannot prescribe the medication that I want, but they said in psychiatry you can prescribe the medication, so that's why I'm here. So they're coming to get a medication. They're not coming for treatment. They're not coming for treatment. So when you make an appointment to see a provider, either a sleep specialist or your primary care provider, your family doctor, your regular doctor, or you're going to a specialist like into psychiatry, don't go and ask for medication. Go and Tell them what you're experiencing. I'm having trouble sleeping, and it's impacting my work. And it's becoming unsafe for me to drive or to do stuff. Tell them what is going on, and be open to treatment, not for medication. Okay, not for medication, because before insomnia can be diagnosed, thorough, detailed assessment is important. Ruling out some other factors is essential, because you can have maybe bipolar disorder and it's a manic phase that is you're not sleeping well. We want to get history. We want detailed assessment, family history, pattern. And remember, if you started with assessment with your sleep diary, you have something to show the provider. So all those things will come together and help with assessment. Then with assessment, we're able to make the proper diagnosis, ruling out what could be going on, checking for other medical issues or mental health issues, all those things, because sometimes once we just fix other things, the insomnia part will just go. It might be a comorbid insomnia, the insomnia that is happening because you have another issue going on, not primary insomnia. So go for an appointment with a professional with the right mindset. And there are three major treatments that we have. We can work on your sleep, after thorough history, after looking at the sleep diary, we can maybe just need a healthy sleep habit. Some people don't know simple things that they need to do. But when we do the thorough assessment, we're able to treat that. Or it might be a form of therapy, which we call cognitive behavioral therapy for insomnia, CBTI. It is specifically for insomnia. It typically takes about 6 to 8 weeks to work on some specific things, which include, your sleep habit, the way you're thinking about sleep, the resting, and other phases like that that would help with the sleep architecture. And then you'll be able to address that issue. And then the last treatment type is medication. And there are different types of medication we can use. The one that a lot of people like going to is the benzodiazepines. Benzodiazepines are not good for sleep, at least not in the long term. For one, they are habit forming. And when we're dealing with one problem, we don't want another one to start. So a lot of people come and they'll say, "Give me clonopin." I had somebody telling me about 2 weeks ago, "Oh, since I stopped taking that clonopin, I've not been able to sleep well. I can't sleep without taking it." I'm like, "Well, benzodiazepines, they're habit forming, they're controlled substances. The safest way to use them is to use them short term and discontinue. If we're having a reason to continue a benzodiazepine, then we have to look into another medication to use." So know this, there are different types of medications. There are more effective medications for sleep other than benzodiazepines, which are basically habit forming. So people talk about, what about natural supplements? Well, yeah, there's nothing wrong with using natural supplements, but when you use all these things for long term and it's not working, a lot of times doing a detailed, thorough assessment, examination, sleep study, or physical assessment of even the lungs, the body, the weight. We talked about the risk factors for excessive sleepiness last episode. So all those little things, if we're able to work on it, you might not need medication. And if you need medication, then the provider will be able to pick the appropriate medication for you. If you have restless leg syndrome, we don't need a hypnotic for you to deal with insomnia while you have restless leg syndrome. We're going to give you a medication for restless leg syndrome first. So those are the three things that we do when you go to a professional. We do the assessment and then we go with those three things. I'll say I will just summarize this again. The N and triple A's. And you need the right mindset about sleep to help you. The first A, assess your environment, assess what is going on, assess, do self assessment. It's going to help. Sleep diary helps. The second A is adjust. Once you've done your assessment and you need to make some adjustment, like somebody said, it might just be your mattress that you need to change. It might be the position of your bed. It might be your blinds that you need to change or get blinds if you don't have blinds. It might be having a specific sleep schedule is what will work. Whatever it is, adjust. Now, after adjustment, and if everything is not working, then you go to the last A, which is an appointment with a professional with the right mindset. Now, if you learned one thing here today, just one thing here today, would you give me a thumbs up? Just say a like or something. Make me feel good before I go off live today. Make me feel good. And like my dad said, if you have somebody you haven't forgiven, that might be the simplest solution to your sleep pattern. Just please forgive that person so that you worry less about it and you have a better night rest. Okay, so thank you for joining me. If you learned one thing today, one thing, even if it's the fact that I'm a mental health professional and I'm a practitioner and a consultant and an advocate, talk to me. Even if it's the only thing you learned today, give me a thumbs up, a like, or something. I like to feel good, and I can feel good with your likes and your love. So thank you for joining. If you have a question, if you have a clarification, please send me a message. I'll be glad to help you. I can't tell you enough how many people come to the hospital or to the clinic with a different mindset. If they don't get the medication they want, they are angry, they don't want to come back. And like I tell a lot of my clients, when I prescribe a medication or when any provider, doctor, or practitioner, nurse practitioner prescribes a medication, it goes into your body. It's not mine. But we have the ethical obligation, the passion, and the right thing to do to help you get better and function optimally, not just to push medication on you, not just to get you hooked on a medication. And surprisingly, when you want to give people medication for psychosis or mood disorder or something, they go like, I don't want to be a zombie. But when they want to come for an hypnotic or a benzodiazepine or any habit forming medication, they don't talk about being a zombie or they don't express concern. Not everyone. They don't express concern about the addictive tendency of these medications. They just want it and they're angry if you don't give them. So I'm telling you, if you're listening to me, and please tell someone else, when you go to a practitioner, always go for treatment and not just for medication. And you will be surprised how vested your provider or your doctor will be in helping you to get to an optimal state of mental health. So again, thank you also for watching. Thank you for watching, and I will see you next week. Next week we'll talk about the abnormal behaviors associated with sleep, and then we'll talk about treatments of sleep problems. Until then, my mental health matters. Uh, my yeah. Thank you. Thank you so much, my darling sister Oyebola. Thank you so much. I love you. So until then, my mental health matters. What about yours? Okay. Bye.